Hi there, my name is Elsa Harte and I am one of the recipients of the Brian Adams Memorial Scholarship. And essentially this means that I'm undertaking a research project with the Market Trust UK at the William Harvey Heritage Institute. My research project is focusing on neonatal Marfan syndrome, which is a unique subset of Marfan syndrome. Essentially, neonatal Marfan syndrome is diagnosed within the first 28 days of life, and compared to classical Marfan syndrome, whereby it's autosomally dominant inherited, whereby you're inheriting this from your parents, neonatal Marfan syndrome is unique in that it's a consequence of what's called a spontaneous mutation, whereby it's not inherited from one of your parents. And essentially, what my research has demonstrated is that neonatal Marfan syndrome can present at birth, and you can present skeletally with perhaps patients having maybe longer fingers and toes, and as well it can present cardiovascularly. So this is with issues with the heart. And patients with neonatal Marfan syndrome tend to present with a degree of cardiovascular compromise. And a lot of what I've been looking at over the last few weeks is the genetic mutations involved. And what we've essentially found, and again, it's very consistent with the literature that's already available, is that these patients tend to have mutations in the fibrillin 1 gene between the exons of 24 and 31. And exons are essentially the coding element of your DNA, which determine how we present characteristically. And I've also been looking at the clinical features. And again, as neonatal Marfan syndrome presents within the first 28 days, we usually see it in the clinic and in the hospitals with, again, a degree of cardiovascular compromise. I've also been looking at the interventions that are available and the current future of interventions that will be available for neonatal Marfan syndrome patients. Essentially, what we found is these patients can be treated with a number of medications. Some of these include what are called beta blockers, and these essentially reduce the stress on the heart by slowing down the rate. You can also use what are called ACE inhibitors as well as diuretics, and these cause your blood pressure to be reduced and can take the pressure off the heart. Now, medications are just one of the forms. We also see that with these patients that have leaky heart valves. So then this is where surgical intervention comes in. And these patients can have what are called a valve reconstruction or else a full valve replacement. And what I've been seeing from the case reports is that these have been really effective in bringing the heart back to normal function. And the medical management and the surgical management are just two aspects. I suppose with Marfan syndrome on the whole, and particularly with neonatal Marfan syndrome, we want it to be a holistic approach. And that's where the multidisciplinary team comes in. So for these patients, we want to make sure that both them and their families are supported. And again, this requires a team. So there will be some level of intervention from the Marfan Trust UK, where there's a helpline available and there's a fantastic team that are ready to answer any of the questions you may have. The patients with neonatal Marfan syndrome will also have regular follow-ups with a cardiologist, that's the heart doctor. You'll also be seeing an ophthalmologist, so that's the eye doctor, and you can also be involved with an orthopedic surgeon who will make sure that the child's bones are developing adequately. So that's just a general overview of what I've been working on over the last few weeks. And I just wanted to say a huge thank you to the Marfan Trust UK for giving me this incredible opportunity. And I hope that my research will make a small, if not important, contribution.